Okay, so you should have these notes out, the female reproductive system, and this is the main picture we're going to focus on. You have 8 female body parts, and then you'll have 8 bullet points right here. So number 1 is connected to the vaginal canal, so that's picture number 1 up here. So number 2 down here will be the cervix, number 3 the uterus, and so on. So please fill out these notes as I go through the Google Slides, and the words that fill in the blank will be bolded. All right, the female reproductive system. Let's begin. Okay, here we go. The first one, number 1, is the vaginal canal. It's the female sex organ, so it has some erectile tissue in it, as well as the birth canal. It's going to be a elastic tube, so it's going to have some elasticity or stretchability to it, so the baby can be pushed through. In fact, some women that have multiple births, they even can get vaginal reconstructive surgery. That is actually a thing. So, through this visual, you'll see that that large child needs to come through that very small opening unless there's a C-section where they can't have a vaginal birth. So they make an incision right around here on the bikini line for a female. They extract the baby surgically. Sometimes you can tell if a baby was a C-section baby because they'll have a perfectly circular head, whereas someone was going to be born vaginally, they're going to have more of a cone-shaped head because of that pushing that they're going to have to do through the vaginal canal. Okay, so the outer look of the female reproductive system is something called the vulva. So it has many different parts to it. The clitoris, which is the female version of a penis. And then actually, I'll show you a video in a second how the clitoris becomes the penis if the male has the Y chromosome. All males do. And then you have 2 flaps of skin called the labia. You have the opening to the urinary tract right there. You have the opening to the vagina as well as the anus right there. So you have a tissue called the hymen. That's the membrane that partially closes the opening to the vaginal canal. So there's the hymen right there. It's just different for women. There's different types of hymen, but it's just that tissue right there. The outside are called labia. And between the labia is the clitoris, which is a small, round, sensitive area of skin between the labia. Next. Okay, this is interesting. The first few weeks of our development, everyone starts as female, but if you have the Y chromosome, then through dominance, you get the male genitalia and you cease breast development during puberty. So here we go.
Dear gentlemen, science has a confession. Your life actually began as a female. Well, phenotypically or physically speaking, that is, though some prefer to call this stage gender neutral. As you might know, when 2 people mate, they each combine half of their genetic information together, 23 chromosomes each. One pair of these chromosomes helps to determine your sex. If you're female, you contain 2 X chromosomes, one from your mother and one from your father, while males have 1 X and 1 Y chromosome. At the moment of conception, you were, of course, male or female based on your genes, but the Y chromosome doesn't kick in right away. In fact, the first 5 to 6 weeks of embryonic development are attributed to the X chromosome alone, and females grow from embryo to fully developed through the influence of only the X chromosome. So what does the Y chromosome do? Once activated, one of the genes on the Y chromosome, known as the SRY gene, has 2 functions: to inhibit certain features of the X chromosome and to impose through dominance the physiological traits that a male must have. The ovaries descend and become the testes, and the labia fuses to create the scrotum. If you're a male, take a look. Though it's more pronounced in some men than others, you'll likely notice a line or ridge of tissue on the scrotum, which is called the scrotal raphe. The skin of the scrotum and penis are zipped up like a zipper as the layers of cells develop in the embryo. And the male variant of the clitoris? Yep, that's the penis. If the Y chromosome does not become activated for some reason, then the female phenotype or physical appearance will persist in a male. While we're at it, this is also part of the reason males have nipples. The nipples form before the activation of the Y chromosome and SRY gene, and thus remain through development and life. But you don't develop breasts. Sorry.
Okay, so as you guys can see here, you have the clitoris becomes the penis. The labia come together to form the scrotum. The ovaries become testes, and that's all if you have that Y chromosome. Okay, let's talk about the cervix. That's not actually a body part. It's more of an opening. Okay, so it's called the opening to the uterus, and it dilates or widens to 10 centimeters before birth. That's what actually hurts. The uterus is a muscle that has to pull open the cervix so the baby can come through. So that's where you get that intense muscle cramping from. Okay, let's move on. So the cervix is the opening to the uterus, and it's a location of something called a pap smear. A pap smear is something that you will be doing some point in your reproductive health. You may have already had one. Most doctors will perform these before they prescribe birth control, because if there is something growing in your cervix, then it will increase the growth of that if they give you birth control. So they are looking for abnormal growths on your cervix, and they have to take a swab of the cells in order to do so. So that's what that device is. It's opening up the vaginal canal so they can get a good sample. Let's move on. Okay, the uterus. The uterus is a muscle. It houses the fetus. All right, so here we go. Here's a picture of the baby in the middle of development. So I wanted to make a point with this. As you guys can see, obviously the baby gets bigger, pushes the uterus all the way up to underneath the rib cage. That's why women can get short of breath when they are in late stages of pregnancy, because of all that pressure on their lungs, because the baby is growing. But you guys, right when the egg and sperm meet, a week or so later, that embryo nestles into the uterine lining and displaces a little bit of blood. As you can see here, this is called implantation bleeding. The embryo has implanted on the uterus for growth and development. And so sometimes women who may have had unprotected sex, they might think like, okay, I was ovulating then, I might be pregnant. And then they see this little amount of blood and they feel relieved because, okay, I'm starting my period. When really this is called implantation bleeding, and it's a sign of pregnancy. Menstrual bleeding will increase. This one will not increase. That's how you can tell the difference. So be aware of your body. Unprotected sex, you see a little bit of bleeding a week or so after, that is a sign of pregnancy. You need to take care of your health and the health of your baby at that point. Okay, and then number 4 is unique. It's just the top. If you see like the uterus as a triangle, the top of it is called the fundus. And as you guys can see in this image right here, it can get as high as to underneath the rib cage prior to birth, around 9 months pregnant, making it very uncomfortable. So the blanks here are the top part of the uterus, and it can go as high as under the rib cage right before the baby is delivered. The fallopian tubes. This is a very important part of reproductive anatomy. So this is what carries the egg between the ovary and the uterus. Without that, you would never have an egg in your uterus, and that's a form of permanent birth control where you tie your tubes. The tubes get tied, so you can't transmit the egg to the uterus. Okay, in terms of size, about 7 to 12 centimeters and 1 centimeter in diameter. So they're not microscopic. They are visible with the naked eye. And this is the location of what we call fertilization, where the egg and the sperm join together. And the fallopian tube is the only place in the woman's body where she can get pregnant. Okay, so she can get pregnant when she's ovulating. Ovulation is the process by which the egg is absorbed into the fallopian tube and transported with muscular actions toward the uterus. And the days where the egg is in the tube is the days where she can get pregnant. So what they can do with this information is that you can chart on your monthly cycle when you're likely to have an egg in your fallopian tubes. It's called ovulating. There's even temperature tests and urine samples for women who are trying to get pregnant, but sometimes people use it for birth control when they don't want a chemical in their body. It's called the rhythm method. We'll get to it later. So ovulating is the last blank on that section, and it's when a woman is fertile. So if someone doesn't want to take a chemical-based birth control, they can chart their menstrual cycle and know that during these days, I'm highly likely to get pregnant with unprotected sex, which you should not have if you do not want to get pregnant. But it's better than nothing, right? So the first one is the first day of bleeding, and you count about 11 days into that, or you can go 10 days into it, depends on how long your cycle is. Traditionally, they're 28 days. And these 6 days are when you're highly likely to get pregnant, because that's when you're ovulating. That is when your egg is journeying from your ovary to your uterus. So knowing those days during the month is for some women helpful in helping them become pregnant, but for some helping them avoid an unintended pregnancy. Okay, the fimbria. So if you didn't have the fimbria, the egg would be released into the abdomen and just kind of float around in here and eventually get dissolved. Might even cause infection. So you have to have the fimbria, which are finger-like projections at the ends of the fallopian tubes closest to the ovaries. They catch a released egg and move it down to the fallopian tube. So it kind of looks like a catcher's mitt, and the ball is the egg. That's exactly what's happening. Rhythmic swaying motion will gently swirl it up into the fallopian tubes. Next. All right. Ovaries. They house and mature the egg cells and produce the female sex hormones. So let's say you had to get an ovary removed. Well, then you'd have to take something called estrogen replacement therapy. You are born with 400,000 eggs, but you're not going to have 400,000 periods. You'll only have about 300 to 500 of them in your lifetime. But you have the ability in your body to have like 400,000 eggs. It's kind of an interesting thought. Like, okay, within your body, you have the egg that's going to make your future children. Or you can think like, oh, I used to be an egg in the ovaries and yeah, etc. Don't go too far with that, but just a thought. Okay. Let's see. Endometrium, that's what gets shed if you're not pregnant. That is the blood lining, the uterine lining. Menstrual fluid contains blood as well as cervical mucus. There's like a plug that plugs the opening to the uterus. Vaginal secretions, because the vagina is self-cleaning. It doesn't need to have any cleaners that can actually strip the lining and cause infection, as well as endometrial tissue, which is the lining of the uterus as well. 4 to 12 teaspoons of blood per cycle. Some women are heavier menstruators, and that can lead to an iron deficiency. And then the fertilized egg, called an embryo, formed upon the union of an egg and sperm, will attach to the endometrium, and ultimately that will become the placenta. You won't shed it. It will now become the nourishment for the baby.